so now, again, I guess we've you know, our contributions, and when you look at the fix for this summer was to try and find a way to save Jackson, that our doors didn't have to close as Dr. Roldan was trying to chop us up. That the plan was to put enough money on the table to keep the doors open this fiscal year, which we've succeeded. And then for the next 18 months, collectively with our, you know, partnership negotiated into agreement, we're at the table with not only our employees, but our choice of consultants, the Cyberry Group, our experts from the International, Sellers and Dorsey. We're at the table making sure there's a secure plan for Jackson's future. And the layoffs were knocked down. Obviously, the hospitals were not closed. The 4,500 layoffs did not happen. There was a trimming of about 151 of our members, many of whom have been recalled already. This is a crazy thing that management thought they were being responsible and just chopping for the sake of chopping. And now they're paying overtime, and they're bringing back all the laid-off employees. It's just, you know, unbelievable incompetence. Services cut to Jackson, to the public hospital. Employees who were laid off are being recalled. We're working to get them, every last one of them recalled. And then Dr. Roldan has the audacity this last month to announce that she's going to close the obstetrics unit at Jackson South. Another, gee, look on the line item. They lost $2.5 million. Let's close them down. And this is one of the only midwifery-driven obstetric units in all of Dade County. They have one of the lowest C-section rates, you know, in Dade County for sure. In some parts of the country, they have a 20 to 30% C-section rate. I think Baptist has a 50%. There was an article in the paper just yesterday about the national average is around 51% for C-sections. And our midwives are delivering babies with a 20 to 30% C-section rate. And our stellar leader wants to close down that unit because it lost $2.5 million. We had our experts from Cyberry go in and do an analytic, which management had never done. They just looked at the one line item on the budget, saw it was losing money, let's close it. We looked at it with our experts, and they said, you haven't hired a director there in 4 years. There's been no product line director. Your doctors are leaving. No one has even called them and said, why are you leaving? Right? So our Cyberry team experts called these doctors. They're very willing to increase the number of births there. Our midwives from the community stood up with us at a commission meeting where all 13 Dade County commissioners voted unanimously to tell Jackson's management team, how dare you think about shutting down an obstetrics unit at a public hospital in Dade County. And there was another tremendous victory, and management got beat up by the 13 commissioners. But again, that's politics, and it's so important who we elect. These commissioners are the commissioners we had to beat up who did the 5% cut last year. We've been working with them this year to get on page with us. They finally did it the right way. And just July 20th, again for this year's budget meetings, we're talking to them about the budget. Again, obviously, property tax values and foreclosures. There's another $400 million deficit in Dade County this year. And on July 20th, our commissioners voted to do a tax increase for the property taxes, a rollback tax, to get the minimal need to tax the public instead of the employees, finally, the way they should have voted last year. But a year of pushing on them and telling them, if you don't do what you need to do in Dade County, we will not re-elect you. We will make sure you are unelected. We have in Dade County, and many of you, how many of you live in Dade County? Quite a few. Annette Tadeo is our commissioner. We got to get elected, endorsed by our state council. The only open seat in Dade County, and in her district number 8 in South Dade, 9,000 union members live. We can make or break the difference with Annette Tadeo getting elected to the Dade County Commission. We need to make that happen. Again, I hope you know, these dots are easily connected, I think, when you see the direct effects of our elected officials on our lives, whether it's as healthcare workers or whatever we do for a living. When the electeds make bad decisions, it hurts us and it hurts our communities. and it's so important. So many of our, healthcare workers I know at Jackson say they can't stand politics. We've got to challenge them. We've got to show them that politics is what is driving healthcare in this country, what's driving our economy in this country. We need to show support for all of our electeds who make a difference. We need to help our President Obama. He's got a strong backbone. We need to hold him up strong. We need to support our fight for Alex Seek in this state. We need a woman governor who will vote to turn around the organizing rights at Broward, the next largest public system in this state that needs to be union, to be SEIU. We need to continue the good work and talking to our employees and our coworkers about the importance of getting involved. I think everything we do, you should be able to connect it back to who we elect. And it's so important that you're meeting here today, and I'm glad to be a part of it. And I just think that when we look back in 5 years, whether it's that we're the voters in this country that helped Obama secure health care reform once and for all, the richest country on earth has health care for its citizens, or whether it's at Jackson Memorial Hospital where we look back and say we were the ones who saved Jackson for the patients and the community in Dade County, that the employees are the solution, we are not the problem. Let's stand united, let's stand strong, and let's vote smart.